Welcome everyone to the first session of our second webinar series, themed Digital Health, brought to you by Africa Health Business. My name is Christine Ogenarn and I am the Head of Digital Health and Public-Private Partnerships at AHB. Before I introduce you to the moderator and we start the webinar, I would like to take you through some housekeeping rules. Attendees will be on mute during this session. This webinar will be held in English. If you would like to listen to the French translation, please click on the translation button on your screen and mute the original audio. This is a 90 minutes event. Please observe the allocated time during this session. Please note that you can post your questions in the Q&A section on your screen, and your typed questions will be responded to as much as possible. Throughout the webinar, there will be pop-up questions. We encourage you to respond. And lastly, if you would like to tweet anything about this webinar, please use the hashtag HBS2020. I would also like to take this opportunity to introduce you to Africa Health Business, the organizer of today's session. AHB is a Pan-African consultancy and advisory firm based in Nairobi. Our team of specialists provide a range of services aimed at supporting and promoting the growth of the private healthcare sector in Africa, with the overall goal of improving access to quality healthcare on the continent. Right now, during the pandemic, we're also focusing on strengthening and facilitating the role of the private sector in the Pan-African COVID-19 response. On this slide, you see the agenda for today's event on digital health. I would like to reiterate that this is a 90-minute session. And now it's my great pleasure to introduce you to the moderator for today's webinar, Melissa Menke. Melissa is founder and CEO of Access Afia, a tech-enabled chain of primary healthcare clinics operating in Kenya. Welcome, Melissa, and enjoy the webinar.
Great. Good afternoon and good day to everyone. And thank you so much for calling in. Today, we're talking all about resilient health systems and partnerships. And that is a topic that is incredibly timely, but also incredibly important to me and I think many of us in our day-to-day work. I'm the founder of a company called Access Afia. We run primary healthcare clinics across Kenya and have launched a virtual care clinic as well in response to largely challenges around COVID-19, but also to work on coaching and behavior change with our patients. So I see in my work firsthand every day some of the creative partnerships that have been launched and some of the gaps in the system that still remain. And we will be digging into both of these today. When COVID-19 hit Kenya, we saw new partnerships and modalities of collaboration springing up. Initially, people were joining webinars and WhatsApp groups, and slowly these efforts started to turn into genuine collaboration where businesses were pooling resources through initiatives such as Safe Hands and through the Give Directly program, which got cash into the hands of people who were negatively affected by the virus and its impact on the economy. At my business, Access Afia, we were working with media groups to get good information into the informal settlements, with recruiting firms to help create non-biased myth-busting services, and with community outreach programs to help identify the most vulnerable patients of ours using the data that we had and maintained. So have all of these partnerships that we've all seen spring up made us more resilient? I think a big argument for the motion is that we've been able to fast track digital health innovation, and that's what today is all about. A good example of that is that in Kenya, telemedicine providers such as ourselves now go through a rigorous licensing process instead of living in a bit of a gray area, for example. On the other hand, pain points and fragmentation still remain. Escalation of patients from low-income community clinics such as ours into public center COVID testings was still painful. Contact tracing was working sometimes, but is certainly ripe for a digital disruption. And I hope that we are all seeing the need for improving healthcare financing and social safety nets so that the most vulnerable people do not have to miss out on essential health services just because we're going through another economic shock. We have a really exciting panel today, which brings experience across the digital health spectrum. I'm going to be introducing them, but let us first start out with our keynote speaker today, Didier, who is coming to us as the Director of Technology and Innovation at the Smart Africa Secretariat. Smart Africa is working across a range of interesting projects, from internet affordability to smart cities to improving the continent's innovation and entrepreneurship ecosystem. They're looking at bringing their energy and their talents and their attention to building more resilient health systems, which we will hear more about today. Didier has a wealth of experience in smart cities, technology, and in working collaboratively with the public sector to strengthen these things. Aside from his official Smart Africa duties, he's currently serving as the chairman of the board of directors of Rwanda's Civil Aviation Authority, as well as Irembo, which is Rwanda's single platform for the provisioning of all government to business and government to citizen e-services. And he's also serving as a board member of the Rwanda Broadcasting Agency. Prior to working with Smart Africa, he served as a director general in charge of ICT at the Ministry of Youth and ICT for Rwanda, where he was able to lead the development and implementation of several strategic initiatives, including the National ICT Plan, along with a range of policy and strategy work around digital literacy, cybersecurity, e-waste, and open data. So thank you so much for joining us today, Didier. We can't wait to hear your presentation today on innovation and Smart Africa. Thank you.
Thank you very much, Melissa. Distinguished panelists today, distinguished participants, ladies and gentlemen. It's a pleasure to join remotely here from Kigali this important event. On behalf of the Smart Africa Alliance and myself, I would like to thank the Africa Health Business for the invitation to participate in this discussion on digital health. I wish to recognize the commendable effort by Africa Health Business for setting up this timely discussion given the current pandemic situation we are all in. Africa is the second most populated continent in the world, and with over 1.2 billion people. It is also the youngest continent in the world with a young and rapidly growing population. According to the African Economic Outlook report by the African Development Bank, Africa's GDP growth is expected to be 3.9% average growth from now until 2022. The population, a healthy population yields economic dividends of more productive population, and healthy children become productive adults. According to the World Health Organization, Africa Regional Health Report, it's estimated that for every 10% of increase in life expectancy at birth, there's a corresponding rise in economic growth of about 0.4% per year. However, as you all are aware, COVID-19 pandemic has highlighted the often perilous state of Africa healthcare infrastructure. It's time to reset and reform healthcare system across the continent in order to leapfrog the continent health services and consequently improve health outcome in Africa. Technology will assist Africa to leapfrog development of health services, as well as creating resilient health systems for possible future health emergencies. The vision of Smart Africa's alliance is to develop a single digital market by 2030. And we at Smart Africa are aware of the urgent need to accelerate Africa's digitalization. And for that, we outlined 3 strategic objectives. The first objective is to build affordable digital infrastructure to interconnect the continent. The second strategic objective of Smart Africa is to promote and facilitate doing business and investing across Africa. And the last one is to accelerate the birth and the development of a digital society. And development of digital health infrastructure and services contribute greatly to a vibrant society. And we are glad to inform you that we are in consultation with stakeholders toward more concrete digital health initiative at Smart Africa. The World Health Organization draft global strategy on digital health 2020-25 identify guiding principles for country and Africa digital health strategies. And this includes leadership of digital health in member countries, because political will is need to be clearly marked. It's important to achieve digital health. The second principle is to recognize that successful digital health initiatives require an integrated strategy, and then promote the appropriate use of digital technology for health recognized the urgent need to address the major impediment faced by least developed countries implementing digital health technologies. And there are more success factors from best practices globally, and these include institutional arrangement, both nationally in the region, health stakeholders engagement, legal and regulatory issues to establish strong trust, reliable infrastructure, learning together, especially through experience sharing, effectively bridging financing gaps in digital health implementation, and the use of emerging technologies, which, as you've seen, especially in this period of pandemic, the COVID-19 pandemics have really played an important role, from the use of drone to the use of robots, especially, for example, in the case for Rwanda, where they deployed robots to manage patients, and other mitigation measures which are used now at different airports in Africa. And finally, last but not least, private sector-led investment in digital health. So I'm pleased to inform you that currently Smart Africa has adopted a rigorous project development process. For each project we take, we follow this process that starts by defining the strategic positioning of the continent on a specific topic, and we develop blueprints that are used across Smart Africa member states, and from the blueprints we work into implementing pilot projects. And Smart Africa recognized that we need partnership for digital transformation at this, and recognize the key role of partnerships in this development process of all the projects we do. We also acknowledge the role of the private sector, working hand in hand with government, the academia, but also other development partners. And we apply all this approach for any strategic initiatives that we engage into. Ladies and gentlemen, distinguished participants, in April 2020, Smart Africa Secretariat engaged ICT ministers during the extraordinary council of ICT ministers on the guidelines for a COVID-19 and technology response. And this included working on data privacy and data protection, declaring telecom services as essential services, promote the use of digital ID to ease the movement of people and the goods, support African startups on pandemic management technology solutions, and the use of emerging technologies like big data, blockchain, 3D technologies for pandemic management in Africa. And on behalf of the Smart Africa Alliance, I'm delighted that to inform you that we closed this partnership also with the Africa Health Business, and we look forward to engaging into further collaboration going forward. So I thank you again for organizing these webinars, which raise the importance of collaboration and cooperation with different members and different stakeholders for this important topic, which is digital health. I wish, of course, also to my colleagues who are going to come after me, productive discussions on this important topic. So I wish you a fruitful discussion and deliberation, and I thank you again for your attention. And with this, I have the honor to give back to our moderator for inviting the next panelist, Mrs. Hila Azuzai. Thank you very much, Melissa.
Thank you very much, Didier. Next we're going to hear from Hila Azadzoi from Ada Health. Ada Health uses AI to help patients and providers quickly and consistently assess health symptoms. This technology has huge potential in democratizing access to basic healthcare information and reaching remote communities with convenient access to healthcare. I think specifically for today's theme, consumer digital apps have the potential to make our health systems much more resilient in the future. So as governments and policymakers are planning their responses, consumers can actually have good and reliable information in the palm of their hands. And we're looking forward to hearing how Ada Health is making that more of a reality today. Hila leads Ada's Global Health Initiative. Before Ada, she was a founding member of the head of academics at Kirion Open Higher Education. She's a Digital Female Leader Award recipient, an MIT Solve member, and she is a self-proclaimed completely dedicated to using technology for social good. So Hilla, we're looking forward to hearing more from you.
Fantastic. Thank you very much, Melissa. Thank you very much, Didier, for the insightful already keynote. And I'm looking forward to share a bit more about our work today, about how we are leveraging digital health solutions to support and accelerate universal health coverage. And for that, if we could go on to the next slide, I'd like to introduce more to our work, to the way we build partnerships, and also how does that translate, how does that work translate to low and lower middle income countries, and especially highlighting some of the work we've done to date in sub-Saharan Africa. And I think it's always important to take a step back. And now, of course, during the times of being in a global pandemic, I think everybody is realizing the importance of virtual health, digital healthcare solutions, how important this is throughout this global public health crisis. But even if we take a step back and say, well, generally, 4 billion people are lacking access to basic primary healthcare services. And that in itself is a huge challenge that is only further exacerbated by COVID-19, what we've experienced now in 2020. But kind of the challenge beyond that has been there for quite some time. And we look specifically at that space and look specifically at, well, what are some of the big barriers? What is preventing people from accessing care? And of course, I think we're all aware that there is a massive shortage of healthcare workers around the world, that especially in LMICs is most prevalent, and financial barriers, geographical barriers that prevent people from accessing the care that they need. But what we're looking at is, well, this is a huge challenge, and how can we generally leverage medical AI in that space to support with certain element? Of course, we cannot solve for everything, but how can we already start with increasing access to key information in a highly personalized way? And what we are doing is we have developed over the past 9 years a symptom assessment technology that has the highest currently available diagnostic accuracy, and that is basically empowering people to understand and manage their health. And the way it works is, I'm not sure if this, I think the slides, at least I cannot see the slides anymore. I don't know if they are there for everybody else. Okay, they're back, perfect. So basically what we're doing is helping people with, specifically when the first step of when people fall ill, it is critical to have the right information at hand. And especially in parts of the world where medical resources are very scarce, and every health decision that an individual takes is also related to economic costs for the individual. When seeking healthcare, it is really important to help people in the first place to take them better informed decisions. So this is kind of what we're tasked ourselves with, to say, well, how can we support and empower people to better understand their health, and then based on that, take also better informed decisions. And so for the past 9 years, we have developed together with doctors, scientists, engineers, what we call a medical reasoning engine that encompasses thousands of conditions, from communicable to non-communicable, from common, complex to even rare diseases. Basically a very comprehensive medical knowledge base that we've built up together with doctors, with medical collaborations, but then pairing that with artificial intelligence. And why are we doing that? Because as we are aware that there's a shortage of healthcare workers, it is important that when somebody is falling ill and they're in some part of the world, how can we help collect patient history in a personalized way and provide the guidance that people need? And for that, we have developed what you can see here on the right-hand side. In 2016, we have launched the ADA app, which is one of our solutions that we're offering. That is basically a question and answer type of format. It's a chatbot that is collecting people's patient history, and it starts simply by asking for your presenting complaints, for your symptoms, and then via that we collect basically your risk factors, patient history, and provide you at the end with a probability about the possible conditions, as well as what are the right next steps to take. So that a little bit for context. And since we've launched the ADA app, we currently have 10 million users all around the world that are using the app. The app is for free. Anybody can download it and use it. And people roughly around the world have completed to date up to 20 million health assessments. And it shows that basically people are not just using ADA for themselves, but also actually for others. So for example, family members, their children, elderly, so you can share that technology across a household to help people when they're falling ill understand what might be the possible cause. And because you can access ADA 24/7 in the comfort of your home, especially in times of COVID-19, I always like to say it works as a digital front door to primary healthcare. So empowering people 24/7 with appropriate guidance, and via that also helping to identify, for example, more severe cases that would need to be directed to care, or also helping to reduce transmission by guiding, for example, people to stay at home when it's not necessary. And but speaking a little bit more specifically now about our global health initiative and what we're doing here. So from the 10 million users that we have all around the world, since 2016, roughly 1/3 is in low and lower middle income countries. So we see quite some rise, which is mirroring the demand in these countries to access credible instant health information. And we formed then in 2018 our Global Health Initiative to really look at how can we leverage the technology that we have developed in the most impactful way across resource-limited settings. And how can our technology accelerate universal health coverage and strengthen health systems in a very in a long-term way, and whether it's improving overall quality, efficiency, or the access, but how can this solution be really integrated into a healthcare system to support with this challenge in the long term. So of course, there's a lot of elements supporting now during COVID-19, but the bigger question is, how do we integrate ADA sustainably into local health systems to support beyond that? And the way we do this is by forming strategic partnerships with global health organizations, with LMIC governments, with other local businesses to work together with local partners to also make and the solution that we've developed really adapted towards local needs. If we could go on to the next slide, that would be great. And so an example, how does that look like? The vision to accelerate UHC, I think it's always important. Like Melissa said, we're starting with the consumer. How can we empower people directly with relevant health information? But the next step from there is then when we guide people with the different advice levels that we have, whether it's to self-care, to different forms of primary healthcare, or even to pharmacies, we can really direct people based on their very, very personalized health assessment where and when they should seek care. And via that we can also help leveraging the medical resources that are available in the most efficient way. And there we're looking also to help specifically into helping with the interaction between patients and healthcare workers and supporting that interaction, facilitating that interaction. And what you can see here is on the one hand, by expanding, it's almost like having a virtual doctor 24/7 in your pocket, and expanding overall the access, but also actually without compromising any medical quality. So looking really with the engine that we've built, how can we even improve medical quality, detect earlier, for example, prompt earlier health interventions when it's necessary, for example, when it's about rare diseases or anything that has a severity, prompt people to seek care, but also help people to direct away from care when it's actually might not even be relevant, and people might lose a days of income when seeking care, or taking a few hours, to even go to the next facility, waiting there. So guiding there, well, this might be actually more mild. It's not necessary at the current stage. That improves not only for people directly, kind of creates more efficiency, but it translates, if you kind of think about it holistically, when integrating ADA or our solution as kind of a digital front door, it translates into massive systems impact. And then kind of from a public health perspective, because we've built a very comprehensive engine here, the anonymized aggregated data is specific relevance for public health and decision makers here to really understand what is the disease burden, what is, is there a certain rise of certain symptom constellations when it comes to new diseases, what are really the needs, and how can we allocate resources more efficiently here. And on to the next slide, please. And a little bit of a snapshot before coming to an end about some of our work currently in East Africa. So we have in 2018 started specifically working together with Fondation Botna, as well as our local partner, the Muhimbili University in Dar es Salaam, to adapt ADA to the local setting. And what do we mean by that? So the first step is already, if we want to increase access, we need to be able to speak the language, and we need to make sure that people also understand what we mean when collecting patient history. So we've made ADA available in partnership with local partners in Swahili. The first time that a symptom checker is made available in a local African language. We've optimized disease models specifically for the region to make sure we're capturing the region-specific incidence and prevalence. We're currently carrying out further user research as well as clinical trials to make sure and also test how ADA could be leveraged in a clinical setting, and specifically looking at how we can support the interaction between patient and clinicians. And beyond that, we're also looking to expand further on kind of our reach by the end of next year, reaching 1.5 million people in Tanzania alone, to learn more about the needs and work together with partners to then take the next steps to say, well, how can we now integrate and work together specifically with governments as well as other businesses to increase the potential and the opportunities that digital health offers, but kind of taking the next step to really integrating ADA into the local health ecosystem now that we've built some capacity. Thank you very much.
Thank you very much, Hila. And hopefully you guys see just drawing attention to the polls we're doing. So we will share some data with you at the end. So please take just 1 second to fill out what you think the biggest challenges are when introducing a new solution in Africa. So next we are going to hear from our sponsors at Broadreach. Broadreach is a digital health company that designs and delivers effective solutions to healthcare problems in emerging markets. They help to empower stakeholders to make the right decisions and implement the right actions that help to improve health outcomes and change lives. And they do this partially through a custom AI platform that is using AI and big data to help us go beyond data analytics and actually improve healthcare outcomes. So the event organizers are going to show us a quick video right now.
We are Broadreach, a group of distinct businesses focused on a common goal of improving the health and well-being of underserved populations around the world.
We are Broadreach Healthcare. We focus on winning and delivering large-scale health system strengthening programs for donors like USAID in programs like APACE.
We are Broadreach Consulting. We implement Vantage and provide associated change consulting to help clients improve their healthcare outcomes.
We are Vantage Technologies. We develop the Vantage platform that enables delivery consistently and at scale.
Together, we make up the Broadreach Group. Empowering action,
Changing lives.
Great, and now we will learn a bit more about Broadreach from our next speaker right now. Paul Bowie is an advisor to the board of Broadreach. He personally has over 30 years of experience in senior executive roles and also acts as a coach to help companies through their digital transformation, through innovation, and building effective go-to-market models. He's worked in a number of organizations, including being a partner at KPMG, a managing partner at Hewlett-Packard, and also an executive partner at IBM. He is personally passionate about being a customer-focused leader and working on models of value-based leadership, which I think are also very important to us when we think about how to make our health systems more resilient. So over to you, Paul.
Great, thank you. Can we go to the next slide, the introductory slide? Thank you very much. And just to put that video in context, what I'll be talking about are solutions and services that reach across that whole spectrum of companies there. And first of all, thank you to HB and as our partners for inviting us. And I'm really excited because I really want to share with you our point of view on the kind of the problem statement in front of us today, which is really about, how do we bring the world of partnerships together. Hello. Hello, can you hear me?
I think, Paul, we've got you again, so you can continue.
Yeah, I'm not
Thanks.
sure what happened there. Just kind of back to that first slide. I mean, we really kind of live by our vision and our mission, and our vision is a world where access to good health enables people to flourish, and that's what really drives us as our long-term vision. And we really want to see people flourishing where we can actually make access to good health a possibility. But underneath that, our mission is really a bit closer to what we're talking about today, where we harness health technology and innovation that starts empowering human action. So what I'll do is I'll start to kind of building on that story. But before I start, just a bit of background on Broadreach. We're a company that was founded in 2003. We work across 25 countries in Southern Africa, West Africa, and East Africa. We employ about 12,000 people, professionals from technology to medical professionals working within our programs. So next slide, please. So I just want to share our strong point of view that digital innovation and new partnerships are absolutely critical for resilience in health systems. And I hope there's no ambiguity in that statement. But also, when you look at the counter side of this, the crisis that we're going through, and hopefully it will be over soon. But with these studies from McKinsey are showing us that although that's kind of pushed digital transformation forward and presenting new opportunities, very few executives are actually feeling that they're able to take that challenge. If you just look at the numbers, 90% believe that the COVID crisis will change the way they do business. 85% are concerned that their impact to their customers will change. Well, so the change in their customers is going to impact them back. And only 21% of them actually think they've got the resources, commitment to make that happen. And most of them, 2/3 of executives, and we can count some of ourselves in there, is that this is going to be the biggest challenge in our careers going forward. So how do you actually start resolving some of those gaps between what the opportunity is, what the barriers that executives see, and how do we actually address them? And I think this is where digital partnerships must deliver resilient platforms. And it's not always about just the resiliency in the platform, but we must be able to deliver resilient decisions. And we must make sure those decisions are delivered at the right time. And operationally, we can then scale those decisions up so we get performing healthcare programs. And also within that, there's this balance that we need to create, that there's a natural tension that innovating and speed at scale can also provide some shortcuts sometimes. And so, we must be able to do those on platforms with partnerships where there's a secure, scalable, resilient platform. And that's where we should start. And what we'll talk about a bit later is also what that means into how we've started creating the future of work in healthcare. And just to kind of highlight a couple of partnerships there. So, in a prime partnership we have with Microsoft, we're a gold partner. We're their largest independent software vendor in Middle East and Africa in healthcare. And most recently, what we've been doing is working with them on their Health Cloud launch, which I think is very soon in the next few days. So we're one of a few selected partners working with them on that. And that partnership is really how we've started thinking about how do we build resiliency from the bottom upwards. And at the other end, we're working with companies such as Access Mobile as a partner, where we're actually starting to think about how do we extend our value chain from being able to deliver insight and the right insight experience, but how we then extend that value chain beyond into patient experience. So taking the outcomes of what we can bring as insight and making sure those actions happen through using behavioral sciences and so on at the right patient level, creating what we call in behavioral science the right nudges to make sure that the right patients are actually taking their treatments rather than ignoring them and then ending up in worse conditions. So next slide, please. So yeah. So I think without the build, but if you want to. So I think if we look at the left, just putting what I've said in context, this is why we really need to change our approach. When we stand back and we look at the investments that are being made in emerging economies we're sitting in, against their strategic goals of population health, economic development goals, and education, pretty much all of those are underperforming. And then we start looking at some of those root causes. And some of those root causes really are kind of collected here, is that there seems to be suboptimal decision making at all levels. And you can ask the question why. And usually it's because people don't have the right information to make the right decision at the right time. And sometimes it's also information overload. So what we're also observing is that, the world has gravitated towards a world of dashboards, but actually what people really need is insight, and how to turn that insight into action is where we come in. So our systems are built on the technologies I've spoken about, but they're using artificial intelligence, machine learning, natural language processing, and various other AI methodologies in there, so that we're not just saying, here is all the data for your district or your region, but it actually says to you in a very natural language process that says, you should think about taking action with these 3 clinics, because if you do these actions, it will improve your performance by X%. The next one is about fragmented and incomplete data. And really, this is addressing the problem of there are multiple data sources. And when the first question you ask is how complete or good is your data, we all know the adage about quality in and quality out. And one of the things we worked very hard on is actually automating that data pipeline and making sure there's resilience in the data as well. And where does that lead to? The other root cause here is people are making decisions, based on the lack of insight. So sometimes incomplete data, suboptimal decision making, and you're in a corner where you have to make a decision, And when you're not making that decision on data or information that's grounded on clean information, then you lead to poor results. And those other observations there about limited operational capacity and inefficiencies. This is the thing that we're always trying to balance when we look at our world of in healthcare. Is that how do we balance the burdening sort of growth of demand that's placed? So increasing demand in terms of diseases, increasing numbers of patients with supply, with the number of clinics that may be available, the number of people that are available as well. So what our systems are doing always is trying to balance this supply and demand inequality. And also one big thing that we see is a lack of standards in best practices. So as I talked about dashboards and how dashboards are now starting to become almost a barrier to getting you insight. Now we've got insight. In 2 or 3 years, if we don't take the right actions, insight will become the next bad word, because if we don't marry up insights with how we actually deliver that insight through a workflow to make sure what that insight is telling you has happened within the health system, then it's a semi-resilient system, because it's giving you insight, but you don't know if the action has happened from the insight. So just building up on the right-hand side there, what we're talking about here is thinking about how we take all of those issues that we see on the left and root causes and build resiliency in. And the first part is by adding a partnership around a cloud platform. I talked about our partnership with Microsoft, and we built our solutions on Azure. And with that comes scalability, security, compliance, and resilience. And then when you start adding elements of the fourth industrial revolution, such as artificial intelligence, machine learning, big data analytics, and natural language processing, we start enabling the experience and changing the experience. But also, finally, how do we turn that insight that we can generate through artificial intelligence into action? And this is through partnerships, as I talked about with Access Mobile, extending into patient engagement, assuring data quality, the ability to use chatbots to actually talk with your data in a collaborative environment, and also enabling workflows as well. So when we start bringing all of these things together, not only are we starting to talk, and a couple of technical terms here, talking about democratization of data, but we're also talking about interoperability of that data, and that's how we believe changing the future of work for healthcare will happen. Next.
Great, Paul. I'm going to have to introduce Robin in a second, but I'll give you just if you want to wrap up on your last slide, maybe just a quick. Yeah. Okay, great. Thank you.
Great. Next slide. Yeah, and this is just a quick proof point of bringing all of those partnerships and technology together and an understanding of what's achievable. So when our COVID response started on the 18th of March, this was our population under the big programs we were running. We were looking after people, 2.5 million people on ARV. So that was the population at risk. And what we did was turned around quickly to create the platforms and services for our response for COVID. And from a launch date of the 9th, we had trained up nearly 10,000 healthcare workers in 48 hours. Most of that was remote training because it had to be. And to date now, we've got over 4 million, nearly 5 million screenings completed, and that goes up to about 8 million when we add data sources in for screenings, and 50 million questions answered. But the point I want to make here is that we've built resiliency into these processes, but by building it on the right platform, the system scaled up, it never went down. And as we saw with some of our other colleagues in Africa as we were responding to the COVID crisis, building resiliency in both in your processes and in your platform actually assures that our patients, which we were represented in the numbers here, receive the right healthcare. Thank you, Melissa.
Great, thank you. So we have another poll popping up that you can answer as I introduce our next speaker. Next, we'll hear from Robin from Amazon Web Services. Amazon Web Services is actually the largest and most broadly accepted cloud platform globally. The health industry, despite being highly regulated, clearly has a lot of healthcare data, and Amazon Web Services is looking to help us unlock the potential of healthcare data so that we can make better decisions. So we'll hear from Paul about how AWS is specifically looking at moving from beyond data for data's sake into a system where partners can collaborate to improve healthcare outcomes in the end. Robin himself is an accomplished business leader with over 15 years of experience in strategic operations and business development. He has a strong background in understanding technology solutions and how they align with client business needs. And he's also an expert at influencing change by analyzing business needs, negotiating deals, and building effective partnerships. So Robin, we're looking forward to hearing how you and AWS are working at improving resiliency across our health system.
Thank you very much, Melissa. And really great to be here as part of our partnership with the AHP. We have been working with the AHP in the past couple of months, and we are excited at the potential this is opening up. And also today, as we speak about digitally enhanced and resilient healthcare and partnerships, we really look forward to the next few minutes. I'm going to go straight ahead into the next slide. And just looking at the last time we were together, I remember we were then referring at the impact of COVID over the African continent and the kind of headlines that we were witnessing. And as we speak about a wave 2, it's very interesting that we seem to be almost getting back into the same systems and the same trajectories. And we look forward to the next few minutes, even as we speak about some of the work that we have done within Africa and beyond, in terms of being able to pick on the lessons from COVID and leveraging our global and industry expertise to be able to then make a difference. If we could move to the next slide as well, that then speaks to the digital health trends that we have been observing at as Amazon Web Services. At the heart of everything that we're really observing is a real need, and I think quite a number of speakers before me have highlighted this, is a real need to ensure that the data that gets collected is really leveraged. And I like what the speaker before me actually came and said. It's not just about picking on insights. We talked about moving from data into insights, and then moving from insights into actionable and execution and executable actions. And therefore, some of the trends we're seeing when we look at the digital health trends, we're seeing a real need and a gap in resources in terms of how infrastructure needs to be better managed. We're also seeing a general, and this has been highlighted even before me, we're seeing a general increase in the volume of digital data, the amounts of data that is being processed every single day: patient data, healthcare institutions, providers, payers, government and regulatory kind of data, and being able to then pick all that and leveraging the continuous technology advances will then be a key differentiator in terms of then enabling the digital resilient health industry that we keep referring to. Some of the gaps that we have observed as AWS is that some of the existing technology platforms, especially around the traditional platforms, we're seeing a gap in two particular areas. We're seeing a gap in the ability to scale. So every time we have a huge spike of needs, and particularly the last few months have really exposed us as an industry in this space, we're seeing a real gap in that ability to continuously scale, or even actually, and scale here is not necessarily upwards, could actually be downwards. We're seeing a gap in terms of the ability for technology to be able to then rise and come down as needed. And therefore, we are seeing also up to 75% of IT spend being used to just take care of the operational aspects of existing technology, and healthcare providers then being forced to really just keep the lights on from a technology perspective, as opposed to really using that time to be able to innovate and look forwards. One of the speakers actually did mention here, and as we talked about the continuous technology advances, as we speak about the ability for platforms to engage also with chatbots, for us to be able to then collect customer history and customer relevant data, it is going to be very necessary for existing data platforms or technology platforms to be able then to also be agile enough. And we've seen gaps in terms of traditional technology platforms not being able to adopt fast enough. And therefore, when you think about the gap that then makes and the difference that that makes, we could have all the relevant technology. We could have all the relevant, whether we're talking about applications, whether we're talking about technology platforms. But if our traditional IT applications are not able to then be agile enough to adopt this, then this could potentially, in the patient world, make the difference between life and death. If we move to the next slide, then this refers to now Amazon's, as an organization, we have been in place since 2006 with a really rich history in terms of being the world's most comprehensive and broadly adopted cloud platform. But more importantly, and for the purposes of today, we are talking about more than 8 years of a dedicated healthcare practice with quite a number of professionals being being part of our team. So when you look at what is in front of us, and particularly on the right side, you're going to see a whole list of resources that we are able to leverage. And then this allows us two things. It allows us, number one, to bring our industry best practice and industry depth, but it also allows us to then bring health-specific expertise that then allows us to make sure that at the heart of everything we do, our mission as an organization is to be the most customer-centric organization on earth. And that means that every time we think about an industry like health, at the heart of that, or who we think about as our customer, is really the patient. So whether we are talking to and working with providers, whether we are talking to vendors, governments, NGOs, NPOs, at the heart of all that we do is really a customer obsession to ensure that the customer engagement, the patient engagement, patient experience is really at the best. And I'll be deep diving into this on the next slide as we talk about what are the real three aspects of the difference that we bring as Amazon Web Services. And we've divided our value proposition to the healthcare practice into three levels. Level number one, we're referring to as cloud transformation. Second piece is around predicting healthcare relevant events. And the third piece is around personalizing the health journey. In very brief term, what then this means for us is at stage one, or what we call the foundational level, is an ability to then ensure that the infrastructure is fully optimized and leveraged to ensure that whatever, even before we talk about getting the data out, we referred to earlier about getting the correct data, because yes, data for data's sake is really at the end of the day not really is not very relevant. We need to ensure that first we are getting the correct data, it is being optimized, and then it's data that could be collaborated in, particularly in health sector, where we have all manner of professionals that need to leverage the same data around this patient. And therefore, when we refer to cloud transformation in stage one, this is ensuring that whether you're talking about computing, whether you're talking about storage, whether you're talking about how that access to that data, we're ensuring that the infrastructure and access to that data is then fully managed and ensure that it is not just managed, but fully secure. Stage two refers to predicting healthcare relevant events. And this is when we start talking about insights. What insights are we then leveraging? And we have partnered with organizations and around developing solutions around artificial intelligence, around machine learning, around enabling chatbot engagement, and all the, when you talk about the 4IR enabled and emerging technologies, this is now the difference that then having the correct data and putting together the infrastructure to then enable how we synthesize that data and now use the complex algorithms around artificial intelligence and machine learning to then start predicting healthcare events. And when we think about the season we're currently in, how relevant is this technology when we are then able to predict, and not just at a regional or country or global level, but actually at an individual level, where based on the data history, whether collected through some of the technologies that have been mentioned here through a chatbot, then to synthesize that data and be able to then emit it or be able to have that data emerge out in a way that then we can get insights that allow us to predict future events. The third piece talks about personalizing the health journey. And this speaks 100% to ensuring that the patient experience is super personalized. I talked about the foundational level where we're ensuring that the data is stored well, that we have enough computing speed and enough computing sources to ensure that this data is accessible and accessible correctly. And then the second piece is where we are then able to synthesize that data and then bring it out to be able to predict healthcare related events. And the third level, with the insights and information that we then are able to build together with our different partners, we then are able to make sure that the experience at a patient level is super personalized and therefore not generic in any shape or form, as has been the case in previous times. And this now then starts talking about personalizing the specific patient's healthcare journey. I'll move to the next slide as we speak about how then have we been able to do this. Coming out of, before we actually could immediately deep dive into two of our customers, this is an experience that we have already been able to drive with two organizations in East Africa. Most recently in the COVID period, we've done several other projects before COVID, and when I say two, I only limit it to two because we have a global practice where we do not mention customers unless they give us express authority to be able to mention them in public. And therefore, we've had two healthcare providers who I will be sharing about in a moment or two, that during the COVID period, the fear around the patients, we then were able to consult and were able to put together a platform and a solution that enabled telehealth consultations, and therefore patients no longer needed to be within the confines of the hospital, but were still able to leverage existing technologies and still have a consultation with their doctors. I'm not able to see the screen, but I'll go on. I hope that you're still able to hear me. Sorry, are you able to hear me?
We have you back just now.
Okay, sorry. So just, sorry, Melissa, and how long have I been out?
Oh, only about 10 seconds.
Okay, so thank you for that.
Yeah, go ahead.
Thank you for that, Melissa. And I was going to refer to the second organization, again in East Africa, the Nairobi Hospital, that reached out to us at a time when called them Health. And what we're able to do with MedStar Health is an organization that has 10 hospitals and includes more than 250 outpatient care sites. They're based in the Washington, D.C. area. They had built their inpatient engagement portal in a hosted environment. But the problem with that is because they had over 102 sites. In as much as they had all these websites, in terms of a lot of lost appointments and also upset customers. They then made a decision early in the year to rebuild their patient portal on the AWS cloud. And with the help of a consulting partner, today we are talking about them now offering a very effective way for their patients to search for doctors, services, locations, and make medical appointments without fail, all from a single portal. Remember, they had 102 websites. And now as we speak, they've reduced their usual downtime from 2 hours every month to less than 5 minutes every single month. And then the same continues in terms of just decreased download times. And then on the next slide, we're talking about an organization again that was, and in particular, very COVID related, that is taking care of the more vulnerable older citizens with over 1,600 employees. And you can just see that we were able to, through three different Amazon-based solutions, to not only connect their stakeholders and their families, we were also able to create a platform for them to report incidents and also enable them to be able to remain at work, whether remotely, while still retaining the social distancing requirements. Our very last slide actually refers to many other providers that we've been able to work with, both during COVID and also before. And you'll see that we work with quite an array of providers, whether you're referring to payers, whether you're talking to providers and associations, whether you're referring to scholars, or you're referring to public sector. And therefore, as Amazon Web Services, we have worked with customers and partners and governments across the world today to deliver a variety of solutions. Our mission at the heart of all that we do remains unchanged, and that is to remain customer obsessed in terms of working with you, our partners in various aspects of the healthcare industry, to innovate together and then help the industry lower costs, become more agile, innovate a lot more efficiently, and at the end of every day, improve the lives of patients and healthcare consumers. And therefore, we look forward to not just the partnerships we've established in the last few months, and even after the last AHP session, but also to more partnerships that we shall continue to establish in order that we may continue enhancing and creating further resilient and more reliable digital healthcare systems. Thank you, Melissa.
Thank you so much. Just a heads up, Robin, we lost just a little bit of the Nairobi hospital story. So if you have any comms or press releases, definitely link that in the chat, because what we heard was really interesting. And we just love seeing your slide with all of these global logos and seeing some really great Kenyan companies on there. So now we are moving into the Q&A portion, and we have about 20, sorry, we are not. We have one more speaker. Ada, I'm so sorry about that. We're just slightly behind time. So actually our last speaker is gonna bring us home in a really exciting way, because I think something that's been on the top of my mind, and also some of the questions I've been getting, is now how do we have this come together and have these partnerships extend into the government, as well as within the private sector. Ada Mwangola is from Kenya Vision 2030. She is the director of the social and the political pillars, working on leading both the policy and also the coordination of flagship programs for Kenya Vision 2030. Ada is a social development expert. She has over 20 years of experience in government and development agencies, ranging from both the national here in Kenya to international. After several years of working with DFID in Kenya, she helped to also lead their social protection program, and also to provide social development and technical support to all of DFID's Kenya programs. So we're really looking forward to hearing how Kenya Vision 2030 is helping us to build out resiliency in our healthcare system.
Thank you, Melissa. After hearing all that from private sector, it's really a privilege to present the government side of things, how we are faring on digital health. And let me just say that it's really nascent stages, but we are in discussion with AHBS and various government agencies on how we can carry forward the digital health program, which is one of the key programs to deliver on universal health coverage, a key agenda for the current president, as well as the agenda on the health sector to deliver equitable, affordable, quality healthcare of the highest standards for all our citizens. Next slide, please. So digital health is one of these programs, and the main objective is to transform the healthcare delivery system, to improve the performance of the system, to optimize the functionality of national reporting systems, and to automate most of these systems in our agency. KMTC is the Kenya Medical Training College that trains a mass number of healthcare workers. And it is a commitment to ensure the highest standards, and it covers both public and private sector actors. Next slide. So what have we achieved so far within the digitization in the public sector? We have seen a lot of the public health facilities starting from around the third level, which is a sub-county level, to the level 4 hospitals, which is a bit higher at the county level, digitize their data. And that is just how far it goes. They haven't really created a system. The digital health hubs have been established in about 25 out of 47 counties in total. But again, this is just about the data of persons coming in. I remember a previous speaker talking about dependency on dashboards. I totally hear that in the perspective of what's happening in the public sector. And then the creation of a health platform, which is a result of the e-health hubs that have been created. And this has enhanced the district health information software and created a list of the master health facilities, which is basically a list of where the facilities are, and at a dashboard you could see where they're located geographically. Next slide, please. So what is the policy environment guiding this? We have the Kenya Health Policy, which runs from 2014 to the year 2030. And this articulates the place for private sector to do the investments in the health sector. And then there is a proposed e-health bill. The e-health bill is actually quite an advanced draft. It's currently circulating for public participation. And I would probably share it with HBS, if we could share it to a wider audience to get inputs on this e-health bill. And the basic reason is to use ICT mechanisms to deliver and access healthcare services and information, and to regulate the generation of collecting, storage, analysis, transmission, and ownership of patient health data. So this is very important and seen as a key objective for achieving universal health coverage. And then there's the medical health tourism project that we have been working with the private sector for quite a long time, but it has never gone beyond a strategy, a draft strategy. And we would like to coordinate private sector actors who are so much more advanced, especially on the technological space, to make Kenya a hub for specialized healthcare treatment, because we are seeing this as also an economic activity that can contribute hugely to our GDP. But there's need to prioritize the infrastructure in remote areas. Most of this infrastructure, you find them in urban areas, not so much in the rural areas. And there's need for innovation. I see so much innovation from the previous presentations. It's just amazing. And I'm so excited if we could just discuss a modality of beginning some of these partnerships between the private sector and the public sector. Next slide, and my last slide. So how do we partner here? One, I've just mentioned that with AHBS, we are discussing not just about Kenya, but within the East African region. How can we create a critical mass to create this health platform that would help us deliver in Kenya, our universal health coverage agenda, but also across the region, so that there's critical mass for private sector to feel attracted to participate. And we need to take advantage of this policy framework, which is still nascent, and expand it so that we can see more actors coming into this space. And in the wake of COVID-19, digital health has now suddenly been taken very seriously on the public side. They recognize that the delivery mechanism has to really go out there and have real-time information, real-time participation in the health facilities. And of course, avoiding all the protocols of COVID-19. And lastly, the stakeholder engagement to promote joint ventures and partnerships we are very privileged again to be involved in this platform such as AHPS so that we can discuss the modalities, and we really look forward to pushing this agenda forward. I will rest my case, but I think basically we want to promote the digital health program. We want to promote health tourism, and we want to impact at the community level, health for all Kenyan people. Thank you very much.
Great, thank you so much, Ada. That was actually fascinating, and we definitely look forward to learning more from you in the Q&A. We do have some questions around public-private collaboration, but first I want to start with a broader question, and hopefully each panelist can give just 30 seconds, no more than a minute on it. Are we more resilient for the next pandemic? We heard a lot about your innovations and about your specific companies, but if we take a step back and look at the health systems that you all work within, do you believe that we are more resilient for the next pandemic? And whether yes or no, what specifically are the gaps that need to be filled if we want to continue to become more resilient? Hila, if you don't mind, I'll go back to you to start.
Yes, happy to kick it off. I would say, I mean, it's a difficult question to answer, but overall, I would say not yet. I think in every crisis, there is an opportunity that can accelerate the adoption of these tools to make health systems more resilient for the future. But I think we are now exactly in that phase of fostering these public-private collaborations to make effective use of these tools. So I would say not yet, but we could be when we start doing this more and more. And I think all of the panelists have shown kind of the wide universe of tools that is out there and what we could all do. But I think it's now forming that bridge to especially also the public health sector and fostering that collaboration so that ideally in the near future, we could say we have built up more resilience for whatever the next crisis is that we might face, or whatever the next pandemic could be. So I would say we are in a phase where there's a lot of opportunity to ensure that now, but we're not there fully yet, but it is definitely possible.
Yeah. Paul, if we're more resilient, why? And if not, what's one ask you'd make of the global health community to get there?
Yeah, I would kind of align to Hila. I think we're better prepared, but not necessarily fully resilient. And I think we're only starting to understand what that word means. And I think the step here is really now how we bring the technology and how we can move those things quickly, but bring those together with how the processes and workflows need to happen in response to pandemics. And I think we've got a bit better at that by learning quickly here, but I don't think we're fully resilient, but we're better prepared.
Yeah, Robin, anything to add?
Maybe just 2 quick points. I think while we may not be resilient, we're definitely not where we were pre-COVID times. There has been a lot more data collection. There's a lot more synthesizing of that data. And there's also a huge drive towards automation in healthcare. I think for me, the big gap is one word: scalability. Whereas in a region that we are focusing on, Africa, whereas all these advancements in technology may impact the urban folk or urban residents, there's a huge need for us to really think about how we scale in order for us to really build resilience. Thank you.
Great. And Ada, anything to add from your perspective?
Yeah, just the fact that we are much more a younger population, that's a great opportunity to continue to build the resilience. And definitely it's a target group that would work very well in terms of carrying forward, being carriers of this information and building resilience to all across the population.
Great. Ada, I'll actually stick with you to start on the next question. That we have a couple of themes from the advanced questions and from the audience on on how to get better collaboration between private and public sector, which we just started to discuss. So how do we work together, not just on pilots, but on health systems and health data? Anne is asking, how can the private sector help? Sophie's asking, how can the private sector revolutionize the way health data is collected, processed, and utilized? Bringing up the important point that a lot of health data from the private sector does not reach the public sector for the use of better policy decisions. And so let's try and touch on, and also the final question Tony asked about the role of startups. So how do we make sure that the public-private partnership frameworks actually can incorporate smaller and innovative and newer companies? So Ada, I'll start with you and then we'll go in reverse this time.
Thank you, Melissa. That's a huge question, but I'll try. Yes, we do have a PPP framework for private sector that's interested in investing together with government, and that's available. It's a process. But even just taking advantage of the policy environment that public and private can work collaboratively. I think that's a huge opportunity to start that way first. And now that private sector holds so much data, definitely government will listen and work out how then we collaboratively work to common goals. So it is a process. It is a collaboration that needs to be worked out, and it is working, but private sector hasn't, let me, for lack of a better word, say has been a bit shy to kind of push into the public space and claim that and show a value proposition that where government can collaboratively move forward together. But the space is open.
100%. Robin, anything to add on public-private collaboration, data, startups?
I think again, mine is just twofold. Ada earlier on referred to a really huge and younger population, and not just in Kenya, but across Africa. And the one characteristic that is very clear about them, they're digital natives. And therefore, even the organizations that they're putting together, whether as startups, I think there's a real opportunity here to facilitate startups and innovation. And our organization, we are big on startups and therefore happy to do this. But very quickly on the second piece is really that to come together as private and public partnerships to just think about that balance between innovation and regulation. Innovation will always go way ahead of regulation, and there can be that positive tension that I think we can come together and establish the correct balance so that regulation does not stifle innovation, but then innovation does not become dangerous for the public health.
Absolutely. Paul?
I think I'd agree with those last comments. I mean, what we're really talking about here is how do you make one bit of data plus another bit of data? How do you make that equation of 1 + 1 = 3, and about interoperability of this? And where we need to get the minds to meet are really around, as Robin was touching around, on regulation and policy versus the speed of innovation that we can deliver. And I think the way to do this is really think about it rather than in big value propositions, is to start thinking about it in specific use cases that solve specific problems. And once we start solving those and people see the value of how that's done in a very innovative way through AI and machine learning, then I think those bigger issues can start joining up.
Absolutely. And Hila, anything to add?
Yes, I think just a lot, just echoing a bit more what Paul just said. I think it's very important because, yes, there is a lot of data, but there's different applications, use cases to really look into the use case and the specific setting and really see here first, what is the value that any digital health solution is providing in a specific setting? And then how is that data that is being generated complementary to existing data? So I feel like it would start really with the use case, and then by default, you generate a set of data that can further help you with, the ultimate goal that you define. So if you say, well, we need to increase access to primary healthcare in a specific setting, where does that start? Who's that specific target group? What is the information and the data that is being collected? And then how does that support public health? So it's a bit going back to what is the specific use case for each application out there, and then how does that channel into the existing data pool that, for example, the government already holds.
Absolutely. So we already are at 10 minutes to the end. So what's going to come next is I'll give each panelist a closing statement. So 60 seconds, you can use it however you want. A couple of themes I will highlight that our audience was interested in. We've received a couple of questions around digital divide and urban versus rural divide. So potentially one or two of you could incorporate how you're thinking about health equity as we do this digital transformation. I think there's also been noted by Sophie in the Q&A, but also Robin in your notes. One of the challenges really is scale. So any best practice from how groups have scaled up something that's worked would be interesting to incorporate as well. But it's your time. So Hila, let's start with you and Ada Health.
Yeah, so I think I would end with my closing note on really looking at there are so many great technologies out there in the world, and you can really have, the best technology, you could say the world's best symptom checker, but if we're not collaborating or find a way to collaborate, especially with the public health sector, where the majority of the people in LMICs are accessing care via the public health sector, these solutions, and then kind of translating into this type of potential impact, is also not able to scale. So I think if we're looking at, well, how do we scale and bring these solutions in a meaningful way, just highlighting again how important a public-private sector collaboration is to reap the benefits that any solution can offer, whether that's, for immediately the benefits by widening the access to a population to health services, but also looking at the benefits of all the health data that is being generated and how this can be leveraged. So I think highlighting again just what we discussed a lot today about the importance of, if we truly want to scale, then collaboration is key.
Absolutely. Paul?
Yeah, Melissa, I'd really like to touch on, the challenge you posed us around the digital divide and health equity. And, again, where we work, right across Africa, remotest parts of South Africa that I've been to visit and so on, that is a real issue. And, if you look at the COVID response we put together, one of the partnerships I think we need to grow into, beyond technology companies, is also with telco companies as well, so that they understand, we talk about being resilient for the next pandemic. What that means is them also helping that response with things like zero-rated tariffs as well. So when there is data collection to be done, not everybody's got internet, not everybody's even got a PC connection. But what we can do is create the technology that allows you to go and collect data on a mobile platform. But at some stage that has to synchronize somewhere. And by extending the partnerships with the telcos and bringing them into the tent here, I think that's one of the key ways to actually, bring that digital divide together. But I think the message, and I would absolutely support what Hila said, that, the technologies can do pretty much anything you want them to do, but it's really focused on making sure we have the right use case, making sure we're driving value out of that use case, and actually creating real scalable change, both on the technology side, but also really industrialized workflows and processes to make sure that what the technology recommends actually happens.
Absolutely. And that's probably some scalable insights across the continent as well. Robin?
I think I'm going to leverage mine on an area that we covered at some point in your second or third question. We are keen as an organization to really support, partner with, and develop startups. We have a real heart for startups, and therefore are keen to establish potential partnerships. And especially in the context of Africa, we see a lot of niche SMEs and startups coming up with very good local context, but with the inability to scale and expand, and therefore are keen to establish partnerships in the healthcare space. And then in addition to that, then mutually identify and be able to establish the scalability that we're keeping on talking about. Because for us as an organization, it is important for us to do well and also to do good in the region. Thank you.
Absolutely, that's great to hear. Ada, closing remarks.
Thank you, Melissa. I think I have very little to say, but just say, let's just start it. Let's just start this engagement, whether you call it stakeholder engagement, whether you call it partnerships engagement. Let's just start this engagement and start the road towards creating this platform and creating that critical mass. We are ready as Vision 2030 Delivery Secretariat. We have the mandate to convene these forums across private sector and government, and we are willing to come on board with all of you. Thank you so much.
Thank you. That is a really motivating note to end on. I'm going to turn it back over to our event organizers. I think they've also seen a bunch of people are asking how to get in touch with the panelists, so we'll probably get some guidance on that. But let me hand it back over to our event organizers to tell us what's next in this webinar series.
Thank you, Melissa, and thank you for moderating and taking us through the digital health session. And also a big thank you to all the speakers who've taken part in this session. It was really a pleasure listening to you and learning more about what you do and your views on digital health in Africa. I learned a lot today. So also on behalf of Africa Health Business, I want to extend a special thank you to our event partners who made this event possible. And we would like to encourage you to take part in our upcoming webinars, with the next one taking place next week, Thursday, from 4 to 5:30 p.m. East African time, where I will be talking about healthcare financing. So if you're interested in learning more about HB and partnering with us, please feel free to reach out to me using the details below. And we'll be sharing, or we'll be getting back to your questions as much as possible. So hold tight and we'll get back to you. And I would like to thank you for joining us today and see you hopefully next time.
Thank you.
Thank you.